evening we will be we'll be debunking some myths about pregnancy, about childbirth, and we know that there are quite a number of them. There are quite a number of them. As a matter of fact, I think that every phase of motherhood or the journey to motherhood, there's always one thing or the other that one is battling with, or that there's one superstitious belief or one theoretical thing.
Register. Debunking the myths surrounding pregnancy and childbirth. And like I said, my name is Ajibola Olagunju. I'm a registered nurse, a registered midwife. I have my BSN, I have my CPHT, and I'm working on my master's. I give glory to God for all that. So before I really go into this, divided this into 3 stages so that it can be easy. So I divided it into pre-pregnancy myth, the antepartum myth, and the intrapartum myth and postpartum myth. So pre-pregnancy myth is what people have on their mind before they get pregnant. So there's so many things that so many people have on their mind before pregnancy. The first thing I'm going to talk about is timing. Like usually in Africa, generally we believe once someone gets pregnant, once someone gets married, then the next thing after 9 months should be pregnancy. And they start counting right from your the day you get married. And after 9 months, if they don't see a baby or they don't see your belly bump, then it's a problem. Yeah. And then the second thing I have on my slide is preparation. Like there are so many myths surrounding preparation. Like there should be a special plan to prepare to get pregnant. And I believe so many people have that on their mind too. Like, and some people will say that, there's nothing wrong in having a preparation, like a spiritual preparation before you start planning to get pregnant, but there's a myth surrounding it that there should be a special preparation, there should be a special sex for pregnancy to happen, something like that. I'm just going to cut all those out. I believe, and what I'm going to be focusing so much tonight is that whatever you do with your pregnancy, with your childbirth, with your child rearing, it's you and your husband. And I don't want you to feel like you have to kind of satisfy what the community are saying. So I just want you to focus on that throughout everything I'm going to be saying tonight is going to really be talking about that. Because most times, even for marriage, I'm not going to go into marriage, but even for marriage, most times some people just go with the flow of time. Like, this is what people are saying at this time, then I should do it at this time. This is what people are doing at this time, then I should do it at a time. Or maybe this is what my friend or my family member or this person or that person have done at this time, then I have to really do it at that time too. So your timing, your preparation should be just all about you, not about what anyone says or what anyone's what anyone's other person's goals is. It should be all about your goal. It should be the goal of your husband. It should be the goal of your immediate family. It should be all about you. It should be something that makes you happy, something that you plan for, something that satisfies you. Then I'm going to go to the next one. That's the antepartum myth. Antepartum myth, for people that are not in medical line, antepartum myths are when you just get pregnant. So there are so many myths surrounding antepartum, and I see that the hostess really says so many about it. And the first one I'm going to be talking about is the need to eat for two. There's this belief that once you get pregnant, you have to eat for two. Like, you don't eat just for what is going to be okay for you. You have to eat for you and your baby. And if you, God bless you, if you are pregnant with twin, then you eat for 3. And if you are pregnant with triplet, then you eat for 4 and so on like that. So another one is some people say is a glass of wine okay with my pregnancy. And then another myth is need to avoid some type of food. The host talk about avoiding snail. Some people say you need to avoid okra. Some people say you need to avoid unripe pawpaw or bananas. Give me some example of, I want us to unmute ourselves and talk. Give me the example of foods that people talk about avoiding in pregnancy. Wait, is everyone hearing me? I'm only hearing myself. I can't hear anyone.
We can hear you.
Okay, I want us to talk. Give me examples. Give me examples of food that people say avoid when you're pregnant.
Snail.
Yes,
I think I've also heard of pineapple too.
Yeah, pineapple.
Some persons say that, oh, pineapple can trigger contraction, but then you need to eat tons of that before that can even happen.
Right. Pineapples. I mean, probably forgotten most of it. Some people say you can't drink lemon, you can't drink lemonade.
Yes.
You're going to have an abortion. I mean, there's so many things.
Even Zobo drink also, I heard about
okay.
that. and Dr. Tola is saying basically everything sweet and good.
I was going to say that you should avoid soda, you have to avoid Milo, don't drink too much milk. And then someone is saying something?
I said soft drinks.
Soft drinks,
basically
yeah.
Soft drinks, yeah.
Yeah, all the sodas, avoid them because it's not good for your baby. The last thing I have is like you will have weird cravings. Some people believe that you have to have weird cravings. Like if you haven't have that weird cravings, if you haven't crave after that's food outside, or if you haven't have those kind of weird craving like eating sand and stuff like that, you're not pregnant yet. Like it has to be. Okay, so I'm going on to personal care myths soon. Another myth is under personal care, some people say you don't, once you're pregnant, don't do any activities. Don't even go to work. Don't pound yam. Don't cut grass. Don't make amala because it's going to be too stressful. Don't. There are so many things you can't walk too much. I mean, walking, you can't do that too much. You can't, like so many activities that they say do not do when you're pregnant. Another myth that is very, very common in Africa, it's not common here, but it's very common in Africa. It's like, don't walk outside in the afternoon when you're pregnant. You can't even go to the market. And if you have to go, you have to put a safety pin on your dress. You have to do that. Don't visit someone that just had a baby or is bleeding, otherwise you're gonna have a miscarriage. Don't tie anything over your belly bump. Like you can't excuse me, if you have to tie a wrapper, you have to put it below your belly bump. I mean, I actually believe that so much when I was pregnant with my son. Like even when I want to tie my wrapper, then I have to put it below my belly bump, and it gets to the stage that when I was getting to third trimester, it became so hard putting it under the belly bump, and sometimes I put it above the belly bump, and then it's just so weird. It feels like this thing won't just stay. And that's kind of one of the myths. Like if you tie it on your belly bump, then it's going to strangulate your baby. Then some people, there's another myth that you shouldn't exercise during pregnancy. When you exercise, you can strangulate your baby, you can have a miscarriage. I mean, you see, like in nursing school, there's something we learned that human being is a biopsychosocial being. Biopsychosocial beings in the sense that human being comprises of both biological, psychological, and social being. Biological being is just your physique, everything that makes you. And then psychology is like your mind and what goes on around you. And social, which is very important, is what people around you believe. So if you grow up in a family that you have some kind of belief, whether you like it or not, those beliefs just get into you, and you just kind of frame your life around that beliefs, and it kind of makes who you are. So like sometimes why I'm going into that is like Sometimes even when I see pregnant people on social media exercising before now, I'll be like, oh my goodness, that's too much. That's too much. Why would she turn her head upside down? Why would she raise her leg? Why would she, oh my goodness. Like I kind of feel like that pregnant person is doing something really dangerous. And why am I feeling like that? Because of my social being, my psychological being, where I've lived with, made to believe that when you do something like that is a terrible thing to do when you're pregnant. And another thing is sex during pregnancy hurts your baby. That's another myth. So another myth here is like the shape of your belly reveals your baby gender. And I don't really hear so much of this when I was in Africa, but when I got here, I had so much of it. Like if your belly is like straight, is a girl. If it's round, is a boy. Like some old wives' tales around that. And then another myth is if you sit all day, your baby is going to be breech, because your baby is going to turn around and then face up and then butt down because you're sitting down for so long. So I'm going to like debunk the myths I've talked about during antepartum. The first one I was talking about, the hygiene part. I said hygiene is very important during pregnancy. So stay clean, stay neat, clean up yourself. Because I mean, at that stage now, whatever affects you affects your baby. I was talking to my brother yesterday. I said, when you're pregnant, is a stage of, the first thing we did in maternal and child health when I was in nursing school was pregnancy is a state of disease. Whether you like it or not, it sounds something weird, but disease it means like when you are away from your ease. Like when you are at ease, you are well. But a state when you are away from your ease is disease, not disease like sickness. That's not what I mean. Like away from your ease. So that's why when you in your first trimester is so hard for some people, because the body is just trying to get rid of that pregnancy. Like, this is not part of me. Get out, get out, get out. But it gets to a stage that the body adjusts and the hormone suppresses body's reaction to that pregnancy, and then baby start growing towards second trimester and then third trimester. So at that stage, when you know that you're pregnant, everything that happens to you at the stage you're pregnant is equally affecting your baby, because there are some things that when it comes into your body can easily seep through to get to your baby, and some things may not because of the amniotic fluid surrounding your baby. I'm going to get to that in detail. Another thing is, I said earlier on that some people say when you don't walk outside, don't go out in the sun. I mean, there might be some spiritual aspect to it. I can't really cut that off especially for people in Africa. I mean, there might be some, I don't know what happens in the market, why they feel like if you put a pin on your clothes, it's going to take away anything that is flying around in the market. I don't really believe in that, but I'm not going to go into the spiritual aspect now. But if you are pregnant, getting a walk sometimes really is morning sickness. So when you go out, even if you're not pregnant, you realize like sometimes when you go out, you just feel the breeze on your face. You let the air blow on you. You sit down in the cool of the day. It kind of ease you out. It relieves tension. So why would you say a pregnant woman should not do that to herself? And exercise too. I feel exercise is good for everyone. Exercise helps to strengthen your muscle. It helps to aid circulation of blood. And I don't see any reason why exercise can strangulate your baby, so long you are doing according to what you can. The only difference is some people don't exercise when they're not pregnant. For instance, now, if I don't exercise usually when I'm not pregnant, and I'm pregnant and I want to suddenly start exercising, that kind of is going to be weird on my body. So that's why I said exercise as much as your body can tolerate. So another thing is, for the part that says sex affects baby, your baby is protected in amniotic fluid. I was going to bring something here and I kind of left it out. I wanted to bring a pelvic bone and a baby. I probably will get it once I get to intrapartum. So the baby, for a baby is inside a sac, and in the sac, baby is surrounded by something we call amniotic fluid. Imagine a balloon, baby kids balloon that they play with. Imagine a balloon and you put a pencil inside that balloon. If you like punch the balloon, it's probably not going to affect the pencil because you have hair surrounding the balloon. So the baby inside the uterus is surrounded by amniotic fluid, which serves as a cushion. It protects the baby from any external forces. And that's why sometimes, even if a pregnant woman have an injury or fair, it must be a very hard fall to really affect the baby, because the baby is supported and protected with that. God just made it in that way that your baby is protected with that amniotic fluid, which serves as a cushion effect. It's like you're sitting on a chair that has cushion. You're not sitting on the wood under the cushion. You're just being supported by the cushion on the chair. That's same thing for the baby. So, and if it doesn't mean that you're pregnant now, you stop your relationship with your husband, because even when you have sex, except if your provider says stay away from me. For some people, like in second or third trimester, if you have placenta previa, that's when the placenta is low lying, they may say, oh, okay, abstain from sex or some other thing. But if your doctor does not say that, then I think it's okay during pregnancy to feel good with yourself. Sitting all day make you gain a lot of weight. Like I said, some people say pregnant women should not do too much. I would say when you sit all day, it makes you gain a lot of weight, and it may give you back pain, but that does not make your baby to be breech. If your baby is going to be breech, it's going to be breech. My daughter was breech. I wasn't sitting all day in my work. I even stand in my work. She was still breech. I towards my last trimester, I was told to do some maneuver. I did so many maneuvers. She turned to head, and on the day of delivery, she turned back to breech. So babies do whatever feels good for them. You don't know what is going on inside your uterus. Sometimes where the location of your placenta kind of supports the baby to be breech. So depending on whatever goes well with that baby will do. So no matter, even if you're still sitting all day or you're standing all day, the baby will do whatever feels good to the baby. Another myth is about heartburns. So some people say that when you have heartburns, I don't really hear that when I was back in Nigeria, but here they say when you have heartburns, it means your baby has a lot of hair. I mean, I've seen some ladies in labor and delivery here that they say, oh, I had a lot of heartburns and that baby came out bald with no hair at all. So I don't think there's any relationship between heartburns and hair on baby's head. Like I said, the baby is inside the amniotic fluid, so it doesn't have anything to do with heartburns. So I would say heartburns usually is a reflux that occurs in both, mostly some people it occurs all through their pregnancy, but mostly it occurs at the start of pregnancy and at the end of the pregnancy. And I say in first trimester here that heartburns occur due to hormones. Usually when you're pregnant, like I said, it's a state of away from your ease. Your body produces some hormones, especially progesterone hormone, and this hormone, what it does is it kind of make everything comfortable for your baby. And while it's trying to make everything comfortable for your baby, it kind of affects some other part of your body. So another one of the things it affects in your body is the esophagus. The esophagus is the tube that takes food into your stomach. It contains some muscles that opens and close for food to go from your throat to your stomach. So what the hormone does to the esophagus, the muscle that closes and open, it kind of make it soft. So sometimes when food goes into your stomach, it comes back up because it's because the muscles has become very soft. And when this food comes back up, because what helps in digestion in your stomach is acid. And then the acid already, let's say I had yam this afternoon, and then it gets into my stomach, it already mixed with my acid to promote digestion, and then your esophagus open again and it comes back into my throat. Then that's what we call heartburns, because it kind of irritates your chest and it's uncomfortable. So this doesn't have anything to do with the hair. You see, as I explained, I know people that are not in medical line, you may probably not really understand what I'm trying to say, but from what you can get from what I said, does it have anything to do with hair on the baby's head? No, it doesn't have anything to do, because baby is in your uterus, your stomach is in your abdomen. So that's just your esophagus. And the hormones, like I said, also affect the rate of emptying. Sometimes some pregnant women will say, oh, I ate all morning and the food is still sitting in my stomach. it's not going anywhere. It's because this hormone reduces the rate of emptying. Like normally, some people, when they eat, if you work out or you exercise, the food goes down really fast and you are hungry. And if you eat sometimes and you don't do anything, then the food is sitting down in your stomach. The same thing happens to pregnant women. When you eat, the hormones does not let the food goes down really fast. So it sits down for so long in your stomach. And because it's sitting down so long, when the esophagus opens, the sphincter, I said, when it opens, it comes back into your chest and then it causes the acid reflux. I'm not going to go into detail about that. We are not in medicine. And I said for third trimester acid reflux, sometimes you see this belly on my screen now. You see how big it is? It's kind of like taking this place of the stomach. So because of this big bump, it takes the place of the stomach and the stomach does not have enough space to sit. And because of that, some of the food inside the stomach can push back into the throat again, causing the heartburns. Another thing is morning sickness. The myth about morning sickness, some people say morning sickness, there are simple tricks to prevent morning sickness. And some people say it occurs only in the morning. Let me just tell you, use myself as an example. I had morning sickness all through the day when I was pregnant with my son. Morning, afternoon. In fact, mostly I have it in the evening. So I can't really say that morning sickness happen in the morning. And there are no simple tricks. There's nothing like a trick. It's just a process of things you can do. And the thing that I suggested you can do if you're having morning sickness with your pregnancy, it's like the first thing is like you start your day with a simple snack. Like then when I was pregnant with my son, I could not do crackers because it wasn't just going well with me. So I would do dry cornflakes. I'll eat that. And what that does is like, it kind of gives you some glucose before you get up from the bed. So when you eat some crackers or something very bland before you get out of the bed or just after you get out of the bed, and then you stay away from smell, like some strong smell, just like I said, with your hormones kind of may trigger some nausea. Even right now, imagine if you are eating and your toddler is in the bathroom during number 2. You know how you will feel now, especially some toddler that their number 2 is really aromatic. Don't let me go into details about that. So some strong smell can affect and cause morning sickness. And another thing is, I would say, stay hydrated. And I know sometimes in first trimester, it's really hard to stay hydrated because of the nausea. Most pregnant women cannot drink water. And when you don't drink water and you are dehydrated, it kind of adds to your morning sickness and it makes the morning sickness worse. So I would say, instead of, if you feel like you cannot drink water, you can try ice chips, which will take me to another myth about ice. Some people believe like ice, you don't drink water. Like I think the host mentioned that you don't drink cold water when you're pregnant. And just like I talked about the belly and the amniotic fluid, I feel like you've recognized now that whatever you drink into your stomach goes into your stomach. It doesn't go into your uterus. It has to go through digestion before it gets to your baby. So whether you drink cold water or you drink warm water or you drink ice water, it doesn't have anything to do with your baby. It has to digest before you get to your baby. So feel free to drink ice water. If you can't drink ice water, feel free to chew ice cubes, ginger ale, lemonade, all those things. Lemonade, there are so many ginger in, I think ginger ale most common in Nigeria is like Pepsi, Sprite. No, not Pepsi, sorry. Sprite and I can't really remember. I think Sprite and something else contains ginger ale in Nigeria. So you can try and do that. If you feel like you can drink milk, you can put some milk in water and drink. Just try and stay hydrated. I think that will help combat the morning sickness. So now I'm going to childbirth myth. So for intrapartum, that's when you are in labor now. Some myth is, some people say natural childbirth is better. I mean, that's a myth. And even here, I think that's said everywhere. Natural, you have to be natural. You don't have to take any medication. You can't even take Tylenol when you are in labor. It's always okay to be. And I feel like some people feel like you become less of a mother when you take medication with your delivery. Like even taking Tylenol when you're in labor, it makes some people feel like, oh, you are not a mom enough, you didn't do well for your baby. And I think this is more of social part. Just like I said, It's mostly social parts, what some people around have said. I've had so many patients here come into labor and they are really struggling. And I'm like, do you want to take some medication? And they're like, I don't want to take anything. People say this, people say that, my sister said this, my brother said this, or my mom said this, my dad said. And I'm like, most of the times, like, what do you say? What do you say? Stop talking about what people say. What about you? What do you think? What is going to be okay for you now? What do you think feels good for you and your baby? Do you think when you're traumatic or you are broken down and you're crying, and I mean, childbirth is painful, but do you think that enduring that pain and ignoring anything that we try to do for you makes you feel like a better mom than someone else that takes medication? So I think it's all about what you feel about yourself. What makes you feel better? What makes you feel happy? Another thing, they say epidural or pain medication during labor is very bad for you. I mean, except if your provider, maybe you're using a doctor, OBGYN, or your midwife says, oh, okay, epidural is not good for your baby right now. Or I mean, in my hospital, sometimes once you advance beyond 4 centimeters, we say, okay, we cannot give you narcotics because it's going to depress your baby respiratory center when baby comes out. But we will say, okay, this is your other option. So now if you cannot take, usually we say, okay, now if you cannot take narcotics, now we can give you epidural if you want it. So your provider will always say you, this is good, this is not good for you. But otherwise, it's all a myth that says epidural is bad during labor. And some people say epidural increases your chances of C-section. I mean, I don't think epidural increases your chances of C-section. If your baby is not going to do well during labor, it's not going to do well. And if your baby is going to do well during, I mean, my first child, I had a C-section, I didn't get any pain medication. I was okay throughout labor, except when it was time for him to come head down, he refuses to come head down. So I feel like there are so many things surrounding childbirth that makes you have a C-section. I don't think it has anything to do with whether you get a pain medication or not. And another myth is like C-section is bad for you. You see some people in labor that it's like, now this is this time to make decision. We have to do a C-section for you to get your baby out. And then they're like, no, I'm not doing a C-section. And they're head bent of it because of social belief, because of what people have said all around, that C-section is really bad. I mean, this C-section is not the best, but if it comes to what is going to make you and your baby healthy, then why will you be head bent and no, I'm not going that route? I'm not saying, I mean, I've seen some people that walked into the hospital during labor and they say, okay, I want a C-section, I can't do this. Am I going to say they're a bad mom? No, I'm not going to say that. That's what feels good to their body. But I mean, it doesn't still also mean that when you come into the hospital, you'll be like, when they say, okay, this is the right thing for you to do right now at this stage, maybe we are watching your strip and we say, oh, your baby is having deceleration, acceleration, or something is going on with your baby and we have to do a C-section. You're like, no, Edwin. So another thing is, some people believe if you want to start your labor, just go and eat some pepper soup or eat something really spicy, something really hot. It's going to help induce your labor. Those are all myths. Like I said, I'm not going to go back to that your baby is in a sack. What you eat in your stomach does not affect your baby. Another myth is like childbirth is like what you see on TV. So many movies have kind of portrayed childbirth in so many ways. It makes it really look scary. Like, oh my goodness, it's happening. Oh God. And then sometimes in some movies, you just see a splash of water or their pants or their skirt or whatever they are wearing gets so wet and they're like, oh, let's go to the hospital, and the woman start groaning and crying and shouting and wailing and it's not able to walk. And then we feel like that is how labor should be like, because that's what we see on TV. And then some people always say, oh, we always know when you are in labor, you start crying, you start wailing, then you are in labor. And then some people say you must be on your back to push your baby. And then another TV myth is like it's a matter of life and death, the way it's portrayed. So the explanation here, first of all, like I've said most of this, natural childbirth gives you control over flexibility of your birthing, and it's good. I love it. I won't lie, I love natural childbirth, but it also has its own odd I mean, I've been working in labor and delivery for quite some time now. I've seen people that try to go the natural childbirth route, and I've seen people that goes for medication or epidural or something route. It has disadvantages and disadvantages. And but all I would say is, I'm not going to say this one is better for you or this one is better for me. I would say do whatever feels good to your body. If you want to go the route of natural childbirth, I don't know if epidural is that common in Nigeria, but I know about medications that some people still give options of medication. So whatever feels good to your body, do it. I've seen people that want to go the route of natural childbirth and they were a mess. That at the stage that they were crying for medication, it was too late. I've seen people cut my skin with their nails white, trying to groan and yell, and like everything was just a mess during labor. I mean, do you want to go that route? If you feel like, after my friend, the host, went natural childbirth, her delivery experience was really beautiful. If you feel like you're strong enough to go that route, do it. But if you feel like, oh, I'm the kind of person that my pain tolerance is -1, then just do whatever suits your body. And epidural and other pain medication, like I said, it's not bad. Isn't bad, and it doesn't make you feel less of a mother. And like I said, your doctor or your midwife is going to let you know whichever one is going to be good for you. And if it's going to be risky, they're going to let you know. And like I said here again, C-section is not always the best, but if this is what will help you and your baby, don't be intimidated, just go for it. I mean, I remember when I had my son, I wasn't even able to tell some people that I had a C-section because I feel intimidated. I feel like they're going to think of me somehow that you had a C-section. Why? It's your body, it's your baby, it's your life. I don't know. There are so many social things in Africa. Even here, it's not just in Africa. Do whatever pleases your body. Do whatever feels good to you and your baby. So don't be intimidated about what people are going to say. It's your life. And if C-section is the way out, just go for it. Another thing is, labor is not a complex process. Labor is a complex process, and how labor really starts is like there are some hormones that are released by your brain, and this hormones is released mostly sometimes when the size of the baby is big. It kind of stretches your uterus out, and then the uterus feels like, oh, this is now getting big, I can no longer accommodate. Then the hormones is released. Sometimes when your placenta has grown to the stage that they feel like, oh, I can no longer feed this baby, then the hormone release. Sometimes from trauma, and some people that it might be from psychological breakdown. So many things can induce this release of this hormone, and that's how labor starts. It doesn't really have, sometimes you might not even be ruptured. Some people don't even get ruptured. They don't have the amniotic fluid until baby is ready to come out. And like I said, some people even get to the stage that they are in labor for so long and they are already 6 cm and they didn't even know, and they get to the hospital and they're like, oh, you're 6 cm, you're ready to push out your baby very soon, something like that. So I would say plan to enjoy your own childbirth. Let it be a very beautiful experience for you. Let it be something that you like, something that you will, after you push out your baby, you'll be happy and you'll be able to hold your baby. Let it not be a traumatic experience that you need a psychologist after you push out your baby. And labor doesn't always have to start with rupture of membrane, like I said. And sometimes your labor progress even while you're unaware. And like I said, you have control over your birthing process. You don't have to be on your back to push out your baby again. There's so many ways to push out babies now. Some people squat and push out their baby. Some people on their side and push out. Just do whatever feels good to you. If there's a midwife that says no, except if there's a medical reason why you cannot. I mean, here, sometimes when baby is not tolerating a position, we can tell you that, oh, you have to switch to this position because your baby is not tolerating that position. Otherwise, if baby is tolerating your position and you want to labor on your knees, you want to labor on your side, you want to walk around before it's time to push out your baby, do whatever feels good to your baby. Don't let anyone stop you. Take control over your own childbirthing process. Be happy with whatever you choose to do. I think childbirth should be like a wedding ceremony that you enjoy. It shouldn't be something traumatic. And the last one here, I said childbirth is bringing a new word into a new life into the world. It should be a very beautiful experience. Another myth here during labor is like some people says that when you have a good hips, then it will be easier to push out your baby. Your pelvic bone is a combination of so many bones and ligaments, and it's not just about me looking at your hips and your physique and saying that, oh, this is a gynecord pelvis. You can't really look at someone and say, oh, this is a gynecord pelvis from the hips. It has to look, I mean, you can ask all the hips and it looks like gynecord pelvis is a pelvis that helps in childbirth. But you might have all the hips and it looks like a gynecord pelvis, and you might have some bones pointing inside that won't let your baby push out. That's medicine. I'm not going to be going into that. So don't let anyone tell you that, oh, your hips is small, you won't be able to push out your baby, or you are short, or you are tall, or something. Don't let anyone tell you that is all a myth. Your midwife will be able to tell you which one will work for you after there's something we call Bishop's score. They will do that for you, and then they will let you know that you will be able to push out your baby or not. And that's all about intrapartum. And I'm going to go to postpartum. Postpartum is after you've had your baby now. Once you push out the baby, some people say, and even here in my hospital, we hear some people, we want to give them water. I say, oh, just give me hot water. I cannot drink cold water. If I drink cold water, I'm going to bleed, or I'm going to have stomach pain or something. Like I said, your stomach is different from your uterus. Do whatever feels good to you. If you feel like cold water is what makes you happy at that time, just do it. Another thing is, some people say that you must sit on hot water, very hot water, after you had your baby, so that all the blood can come out. I think that's also a myth. I mean, here we suggest that you do sit bath, especially for people that have lacerations and tears. Sit bath is not hot water, it's warm water. It's when you sit on warm water, it just makes you feel good. It's like when you have cramps. We have menstrual cramps and you put hot water bottle in your belly, you know, it makes it feel good. What it does is it makes the muscle soft and it relieves all those cramps. And when you do sit bath, it kind of just helps heal all your muscles and everything. Because when you push out, imagine the size of a baby's head coming out through your vagina. That's a big thing. So when you do sit back, it kind of help heal you, kind of makes all the muscles relax and come back. It kind of aids blood circulation back to that place, and it helps you to heal. So it doesn't have to be hot water. And another one is like postpartum mood changes is not real. I'll tell you, there's so many mood changes after baby. There's one we call baby blues, and there's postpartum psychosis, there's postpartum depression. This always happen. You can't, and don't let anyone traumatize you or stigmatize you if you have it. Baby blues is very common. It's very common among so many women. I mean, I would say literally it happens to almost every mom after postpartum. And baby blues is like, this minute you are happy, the next minute you are not happy. And sometimes it feels like, oh my God, what just happened? Is this baby mine? Is it not mine? And you know, it just like, it's like a change, especially when it's your first baby. It feels like, oh, am I a mom already? And you know, all those things that happen, they are all baby blues. And postpartum depression or psychosis is like opposite of each other. Psychosis is when it gets to a stage that, oh my goodness, you don't even want to see your baby, you don't want to see anyone. Or some people get into depression, they feel like their breast milk is so dirty, or everything you're using to feed this baby. Once you start getting to the extreme that you can no longer tolerate, you don't want to see your baby, you don't want to take care of your baby, you start getting extreme. That's when we call it psychosis and depression. But once it's still mild, like just the happiness and sadness or mood swing, something like that, just like when you have your period and you have some mood swing, that's baby blues and it can still be controlled. But once it gets to the other stage, then you know you don't need help and you need to see your doctor or your midwife. So it's very real. There's nothing that says that it's not real. And so there's this one that says you have to wash your baby with palm oil after delivery. That if you have not washed your baby with palm oil, then your baby will have body odor when they grow up. I mean, this is a lie. I'm going to say that. Baby comes out with something we call Venice caseosa. It's like a cheese-like something that is all around the baby. It looks like a dirt. Some people say it's dirt. It's not dirt. In fact, here we see some people that don't want you to even watch their baby. They want that Venice to be absorbed, because this Venice is what protects the skin of your baby when your baby is inside. And when baby is coming out, it also supports your baby. In fact, here in my workplace, we don't watch baby until after 8 hours. That's the highest, that's the least time you can watch any baby, because we want that Venice to stay on and want the baby's temperature to be controlled before you watch the baby. So Venice is a very good thing for your baby. It doesn't make your baby smell. If you watch your baby 8 hours later, it comes out clean. And you don't have to do palm oil. I mean, if you want to do palm oil, it's fine. But it doesn't mean that until you do palm oil, your baby won't be okay. So, and another thing is I've seen some older women, I don't know about our generation, that once baby comes out, they have to throw baby up like that and shake baby rigorously. They feel like that's the way that baby can, they will say that baby will be strong and will not panic and will not be afraid, because we see sometimes when baby are jumpy, they believe that those babies are afraid. When your babies are jumpy, that's called reflexes. It means your baby is very normal. And when you throw your baby up like that, or you shake your baby, you know what you're doing to your baby? You're causing brain injury. Because when baby comes out, the skull is not fully ossified. So there's some space between the bones and the brain. So when you shake that baby, you are affecting the brain chemistry, the brain anatomy. So that's why we say don't, in fact, here, once every baby comes out, I yell, don't shake your baby. Don't throw your baby up. It's dangerous for your baby's brain. Don't do it. And some people feel like the newborn's head is kind of somehow, you have to mold it to make it pretty and make it look good. Like I said, the brain is not fully ossified when they come out. When you try to mold it, what you're doing is you're affecting baby's brain. Just leave the head. The head is gonna, like I said, my daughter was a breech baby. Her head was like somehow when she came out. And it went back to you. I don't know if most of us have seen a picture recently. No one will know that her head was somehow when she came out. It went back normal on itself, because when they are trying to come out, or when they are trying to sit in your belly, they kind of maintain a posture that is okay for them. And it kind of makes the head looks weird. Sometimes if you have a vaginal delivery, the head looks so oblong. It's because the baby is trying to push out through the vagina. That's how God made it. And then after some days, everything is going to be ossified, and then it gets better. So you don't have to do anything to it. It's okay. You can do massage. Some older women do massage baby's body. That's good. But you don't have to shake your baby or mold the head to do that. And I would say the last thing I put here is like vitamins. Some people believe that once baby is born, you have to give vitamins to your baby. I don't see anywhere why you have to give vitamins, especially if you're breastfeeding. Your breast milk contains everything your baby needs. If you're doing bottle feeding, your pediatrician or some doctor may say if your formula that you are giving to your baby does not contain vitamin D, then you can give vitamin D supplement. But otherwise, I don't think your baby needs vitamin, especially at that early stage when they just come out. And I think most of the things I put here I already explained: the sit bath, the Venice, and baby's blues and depression. And this is about shaking a baby. I told that. And I said it is not recommended to give any medication not prescribed by your baby's pediatrician. Do not give any medication to your baby, please. If you're breastfeeding your baby, there's no need for any supplement. Your baby already have it. And then for formula feeding baby, then your pediatrician may say do some vitamin D. But now I think most of the formula already contain vitamin D, so you might not even need to do that. Another myth surrounding feeding a baby. So some people believe your breasts have to be washed. It's a very special way to make before you can breastfeed, because it's dirty. That's a myth. Once your baby come out, you don't even have to wash. Just wipe your breast with a wipes or something and just go ahead and feed that baby. Your baby gets the colostrum for the first 3 days after your baby comes out. That's very good. All the immunity, if you are 20 years old when you had your baby, all the immunity you've gained for 20 years is what you are passing to your baby in the first 3 days. Your baby really need that. You don't want to deprive your baby of that. Some people say breast milk is only water. Pardon me for other people that are here on this platform. Breast milk is not only water. All your baby needs at that time, if you are making enough breast milk, is breast milk. Your breast milk contains everything, all the nutrients your baby needs. And some people say baby can have diarrhea if you eat sweet. Just like I said, your uterus, your breast is different from your belly. What you eat in your belly gets digested before it gets into your breast. So it doesn't have anywhere where if I eat okra, or if I eat chocolates, or if I drink Milo, then once I breastfeed, my baby is going to have diarrhea. So like I said, I already said that you wipe your breast. I'm trying to go fast. I think I'm beyond my time now. And then I said breast milk is produced through a comprehensive process. The food you eat gets digested, absorbed, and then the body forms breast milk in it. However, some medications you take as well and as an antibiotics can get into your breast milk. Just like I said, your brain releases some hormones, prolactin, that helps aid your breast to produce milk. And this milk is produced from what you eat in your belly. So that's why sometimes we say if you're breastfeeding, watch what you take, your medication especially, because sometimes your baby can suck it out from the breast. But it doesn't mean that if I eat rice, my baby is sucking rice. Or if I eat beans, my baby is sucking beans. I think I pretty much cover most of it. Do we have any question? Is there any question in the chat?
None.
Okay.
Also, there are just so many things. So thank you very much. It was really very insightful. It was really very educative. And I think that more and more parents will be able to make informed decisions if they had this knowledge. And really, that's why, I started this platform to just get more and more people informed, because it is when we are informed that we can take certain decisions. And I also want to thank the dads that joined us on this platform tonight. I believe that we must have learned one or two things, because sometimes maybe the woman is even trying to make some decisions, but the man is countering it. For example, CS, everybody is saying, oh, this woman needs to, the man will say, I will not sign. I'm not going to sign, this and that. And the woman's life is in danger and things like that. And honestly speaking, I don't know, people say Hebrew women, like, even the Hebrew women in the Bible, the stories surrounding them, do you even understand it? And I'm like, where did people get that orientation from? It's actually changing. It's changing.
I talk to my patient. It's all about my patient and the baby. So if you need a C-section, if you're okay with your C-section, my dear, sign the thing.
It's actually changing. And I think that more and more women they are getting to know their rights. They are getting to know what their options are. Right. And things. Those who are preparing. I love the fact that, as you were explaining, there were scientific rationales to back it up. It's not just, oh, they used to go out in the afternoon. Yeah, that's what they said. And you pass it from generation to generation. Nobody's asking any questions. Nobody's taking any, And there's also this one of when the child has hiccups, you remove wool from the, put it on the baby's head. Because I hated that one so much. My sister did this one time. I just came back. I saw wool. I said, what's wool doing? Then she looked at me and started laughing. Oh, she hiccups. I said, so daddy, the wool will stop the hiccup. I'm like, what nonsense.
Hiccups is just body's baby's physiology.
Thank you. So there are quite a number of them that we cannot even exhaust here. I see that I think somebody is raising their hand.
Much as we are talking from the medic's perspective, I don't want us to completely neglect all the social beliefs. Some of them have their social basis, not medical basis now, social basis for things that people say or things that people believe in. Some of them is basically because of lack of understanding. Take, for example, a child born not so big and having a prominent fontanelle. The belief is that the fontanelle is prominent. Prominent fontanelle is the reason why the child is not adding weight. Meanwhile, you are only seeing the fontanelle because the child is not big. Every child has a fontanelle, but because this child is not so big, that's why you are seeing the fontanelle. And the moment you start feeding the child adds weight, the fontanelle is less prominent, and this child is also growing, the fontanelle is closing. But the belief is that the fontanelle is the prominent fontanelle is why the child is not adding weight. Meanwhile, is the reverse. Reverse is the case. So some people, they it's basically because they don't have the understanding. They sort of know what's going on, but they don't have the understanding. Another thing I'm about to say is about maybe if a child is having hiccups and not the wool now, or if a child is trying to cough and you are coughing alongside. My mother-in-law does that. When a child is coughing, they are doing it not because there's a medical brain behind it, but tell you what, it works because it sort of
Yeah, I do it too. Funny enough.
It distracts the child from coughing. The child looks at you and the child is like, what is she doing? And in the process, the child stopped coughing. That's one out of so many examples of social beliefs that actually works. You get what I mean? So we shouldn't, as much as we want to say there are a lot of things that are myths, there are some that also have their traditional, their social or ancient basis. And I don't want us to completely neglect that. That's what I want to say.
Thank you very much. That's a very interesting perspective that you have brought into the discussion, really. So yeah, and it's very, very important, because as long as whatever it is that it's not harmful, that's the word, is not harmful both to the mother or to the child, then some things can, we can let some things slide. For example, so if you remove wood and put it on top of the baby's head, what is that with the child? It's not going to strangulate the child. It's not going to do anything. You have just wasted a piece of material from the shell or whatever, wherever it is that you got it from, and things like that. But there are some of these beliefs and practices that could be very, very detrimental. For example, after bathing the child, you stretch the child's hand to the back. All those extreme practices and things like that, they could be really detrimental to the child, and sometimes you could even leave permanent damages or whatever to the child. So yes, we need to be wary of things like that. But all those things that, like this coughing thing that she said, I actually do it when my children, are coughing, and then I cough along. And one day my husband even asked me, so this cough that you're coughing now, what does it do? I said, well, I don't know, maybe teach them what to do or what not to do. I can't know that I do it and it works, and that is it. So yes, thank you very much. Do we have any other question?
About morning sickness? I came across, I think it was a forum or something, where women were talking about morning sickness, that people who don't experience it during the first trimester, somehow they are more prone to having miscarriages, because it's normal. You're just supposed to be throwing up, you're supposed to be feeling terrible and all of that. Then you find yourself like, I'm okay, I'm fine. What? Like you just now want to start like, I just want to be sick. I want to feel somehow, you get, like the way it is. So it's more like a question and a contribution as well. That there are certain things that go on in pregnancy in a woman's body that is not the same for everybody. And
can I answer that?
Okay.
Can I answer that? Let me go before Pastor Jibola does, because for my two babies, I never for one day had morning sickness. Me, whenever I'm pregnant, it's as if nothing's even wrong with me. I just get up and go till I deliver, till maybe the time that I know that, okay, I'm about to deliver is when the time I start getting really tired and I'm just so drowsy and I'm fatigued and all that. But with morning sickness, first pregnancy, second pregnancy, I never had morning sickness and I did not have any miscarriage. So again, these things they are just, maybe there are some people's, one thing I've discovered is that when it comes to this journey, people just pick a little of their experience and then just capitalize on that and just generalize this. For example, I said I never had morning sickness. It would be very unwise for me to see someone who has morning sickness and say, oh, she's just being very lazy. What is it? This and that. Because our physiology and all of that is really very different from each other. I know some people.
Sorry to cut you. The argument was that the rationale was that the woman's hormone levels are low, progesterone, estrogen, and that's why she's not experiencing so much morning sickness, nausea, and all of that. But it's not always like that. So some people believe that once your hormone levels are low, obviously it's going to affect your pregnancy, leading to miscarriage and all of that. But they believe that once you don't have nausea or vomiting, it means your hormone levels are low, and then you're likely to
No,
miscarry. So
no.
that's the rationale that they're using to justify the claim.
That was why I was raising my hand. So is it okay to talk?
Yes, please go ahead.
Okay. So that was why I was raising my hand. It goes back to what I said earlier on, that we shouldn't completely neglect what people say. Whosoever passed on that information have an idea, but they don't have a full grasp of what it's all about. So with pregnancy, when you're pregnant, why you do a test and it's positive is because you have beta HCG. So the level of beta HCG for individual differs. Some have very high levels of beta HCG. Some have just normal level of beta HCG. And for somebody with multiple pregnancy, their beta HCG levels are higher than people with singleton. But however, it all goes back to how your body reacts. So if you have high level of beta HCG, there are chances that you have morning sickness, and how high it is also could determine how much of morning sickness you have. So for some people, it goes beyond morning sickness. We call it hyperemesis gravidarum. I dealt with that all through my pregnancy. So, but it doesn't mean that because, okay, you are carrying multiple pregnancy, you must be sick. I mean, my sister-in-law had triplets, and she didn't have to deal with the pregnancy the way I dealt with mine, and I carried two. So it does still go back to, okay, there is biochemical part of it, there's your body physiology, how your body physiology reacts to the chemical component of your body. It's just like you have two people who are positive with who had malaria test, and they are both positive. Probably they had 3 pluses or 2 pluses of malaria parasite in their blood. One is totally down, spiking temperature of 39 degrees, and you're like, is it not just malaria? And the other person is walking around the street to walk down to the chemist to buy anti-malaria. And they are both positive, and they both had 3 pluses of malaria parasite in their blood. It still goes back to how your body responds, your body physiology. So fine, those that said if you don't have morning sickness is an indication that your pregnancy is not doing well, or you are not carrying a good or better pregnancy. They have an idea, but they don't just have the full knowledge of what it's all about. The hormone level determines, or sort of give an idea of how well the pregnancy is doing, or how, and that come to place in your first trimester. After your first trimester, it doesn't really matter the hormone level. Do you get what I mean? But it still goes back to marrying your body chemical component to your body physiology. You have the hormone, but you are not being sick. So, being sick, I mean vomiting. You have the hormone, but you are not vomiting. It doesn't really mean that the hormone is not there. It just means that your body is compensating well for the hormone. Thank you.
Thank you very, very much. Pastor Jibola, you want to say something?
I feel you guys already talked about it. But what I was just going to say is that I had a similar experience with my second pregnancy. And like we all talked about, some people, if your hormones are usually really high and you feel like with this pregnancy, it just feels off, then that might be like, there's something going on. And then you don't have to like now come and arrive at a diagnosis for yourself. You can just always check with your doctor and say, can you check me? I feel there's something off. But it doesn't mean that, because you can never compare two people together. And then you can never even compare two pregnancies together. My first pregnancy might be different from my second pregnancy. It doesn't mean that I have to feel the way I felt with my first pregnancy. I have to feel the same way with my second pregnancy. Just like some people in their menstrual period, some people have cramps, some people don't have cramps. Some people during lactation, some people lactate like a cow, and some people does not even lactate well. So it's just body physics. So we can't say this is a right way or this is a wrong way.
True.
I think we have
Thank
a
you very
question
much.
in the
Yes, there's a question. Yes. So the person is asking, How well done and thank you for the presentation. How can moms who can't confront their mother-in-laws in old generation avoid these practices done to their children? So I think she's talking about some of those harmful practices. How can a young mother who is dealing with a mother-in-law who is in the older generation, how can you handle some of these things? So let me pass it to you, senior.
I'm sorry. I'm first of all going to answer it like someone in America, and then I will answer it like I'm in Nigeria. So I would
Okay, that's
say if I
fine.
answer it like I'm in America, this is my life. This is my child. I do whatever feels good to me. So, I mean, respectfully, I'm not going to be rude, but I'm going to do it respectfully. This is I mean, for some moms, like grandparents, they had you or they had your husband, they raised your husband in a certain way. And sometimes most of them want you to do it the same way they did it. Those words is no longer the world we are now. Just like I'm not going to force my daughter to raise her children the way I raised her. The world she's going to be then is going to be different from the world I am now. I mean, we can make suggestion because sometimes we might be in the blues. When I had my daughter, I was in the blue because when I had my son, I had everyone around me. When I had my daughter, it was just me. And I'm like, what am I going to do in this case? What am I going to do in that case? Like sometimes when you're in the blue, even if you are a medical person, you know everything, you've been in labor and delivering us for 10 years. When it comes to you, you don't know anything. It feels like, what am I supposed to do right now? So sometimes if people are making suggestions to you, I mean, you can weigh it, see if it's okay. Sometimes some suggestions are okay. That's why we're not throwing out all the meat, just like Dr. Fumi said. We don't throw out everything they say. We wait and see if it's okay. But sometimes some suggestion might be detrimental. Like if someone is saying I should throw my baby up and I know this is not good for my baby. So now I'm going to talk if I'm in Nigeria. If someone says I should throw my baby up, or someone says I have to wash my baby with palm oil and I'm not okay with it. Okay, I'm going to sit that person down and explain. Then once I explain, and if the person is still standing their feet, okay, sorry, I'm not going to wash my baby with palm oil. Or if I'm going to exclusively breastfeed and someone feels like, I mean, there are sometimes I want to, that's why in the presentation I said, do whatever feels good. Don't say that I want to exclusively breastfeed and you're not getting the breast milk and you're still stuck on trying to exclusively. And there's something about breastfeeding. Once there's anxiety with the breastfeeding, you won't make milk because you need your brain to be in the right mind to make that milk. So if, like my daughter, when I had her, I had C-section, everything was going all around me. I was cold coming out from the OR and everything. And and I wanted to breastfeed her. And when the nurse came to me, I wasn't in the right shape to breastfeed at that time. And she was like, what do you want to do? I said, what do you have for me? And she's like, we have formula. I said, please go ahead and give it to her. The main thing is for her to eat at that time. That's all I care about. So it doesn't mean like, oh my goodness, some people is going to hear that I gave my baby a bottle, something like that. So at that time, whatever feels good, whatever works for you, don't be too hard on yourself and don't be too tense on other people too. Like if my mother-in-law say do this, if it doesn't work for me, I will explain to her why it doesn't work for me. I mean, I'm not going to throw it out. I'm going to listen to her rationale and I'm going to view it, see if it works. But sometimes they know better than us because they've been in this world better than us. There's this adage that says there's no many clothes that you can have. You can't have as many rags like the adults. So sometimes they really know something. And sometimes you might want to view it or weigh it. But if that thing is going to be detrimental, like formula feeding is not dangerous for my baby. But if my parents or my mother-in-law say I should formula feed and I don't want to, all I have to do is explain to them. And then if they really still want to formula feed my baby, then that's when we have to like stand the ground, like this is what feels good to me. This is my plan. I mean, I just feel like you just have to do it in the right way. You don't have to get angry about it. You don't have to make chaos about it. Just do it in the right way. And I feel all everyone needs is understanding. I mean, my mom is there. She tells me that my breast milk is watered. I'm not feeding my son well then. But I made her understand. And then she agreed with what I said after I made her understand, even though every day she still tells me it's water. But she agreed with what I said because that's my own way of doing it then. So I feel like we just have to make everyone understand, and there's no need to fight about it. Once everyone understand, just the most of it, what I'm going to say, take home from this meeting is do whatever feels good to you, not what the community say, not what the family say, whatever feels good to you and to your baby. That's what you should do.
Thank you very much. I think more and more mothers, women are tending to know that, oh, okay, they can be more in charge and all of that. But then we also cannot neglect the fact that some persons' unique circumstances, some persons also may not be as privileged. So what happens in the case whereby, oh, you have told, some mother-in-laws could be very, very overbearing. They could be very overbearing. They would stop at nothing to drive you crazy. So explaining to them alone will not just work, and they are still very adamant. There have been cases of mother-in-laws or grandparents who say, oh, I must breastfeed this child, whose child, my child, you want to breastfeed, and things like that. So how do you begin to marry it? I would say that the woman will require a lot of wisdom. You will also, and in this culture, in this our Nigerian culture, there's some lines that you cannot cross, and there's, you have to be careful and all of that. There are a lot of things that you can do and get away with in the US, and that's fine. But then there's also family dynamics. I, for one, I'm very close to my mother-in-law, so there's nothing I cannot tell her. I say, Mom, you cannot throw my child up. If you throw the child up, I will bundle you away from this place. We will laugh about it, and no offense taken. But not everyone has that kind of relationship with their mother-in-law. So in that case, you can get her son to talk to her that also this thing that you are doing, I don't like it, because I think the impact will be maybe the landing. There's a soft landing it gets if it's coming from the son compared to if it's coming from you. It may sound like an affront, it may sound like an affront and things like that. Then there's also one very wise thing that some people do is they plan with their healthcare provider. So maybe on the day of immunization, you have told your nurse already that, oh, please, my mother-in-law wants me to start feeding this child formula. Please help me explain to her why breast milk is this. And then, so there are different ways like that. I also feel that in little things, also in the little things, you should be able to be establishing some boundaries here and there, in little things before it amounts to the big thing. So I think that that's the approach, because the fire brigade approach of, oh, it's my life, it's my baby, and you get out, it may not work for everyone and in every situation. So I think that someone was raising their hand, and we haven't. Vicky.
I think there's still a question about that. I'm trying to type it in the chat. There's still person that asked the first question we're talking about, say asked some more questions. Okay. Was like talking about when you had your baby, why some during childbirth, if baby is not crying, they turn the baby upside down and shake the baby to make baby cry. And I'm trying to like answer the question in the chat now. So what I would say to that person is that for childbirth right now in this world, that's why I said it depends on where you are having your baby, home birth or hospital birth. In home birth, I don't know what some people do, but even in home birth now, there are some trained traditional birth attendants that know the right thing. It's in the older time that when you have your baby and your baby is not crying, that they take baby and shake baby like this. I don't think that really happens anymore. There are sometimes that when you have your baby, the baby doesn't really cry very well. I mean, and crying doesn't mean that your baby is alive or not alive. Well, I mean, crying just helps to increase breathing of your baby. I just want you to know that. Usually what we do now is if baby comes out, there's so many resuscitative measures, we call it NRP. They might rub the baby's back like this, rub baby's back, wipe baby's body. And if that doesn't happen, then there's something we call Bob syringe. They use it to suction baby's mouth, suck it out, put baby under a warmer, like rub baby, try to do so many things to make, rub baby's chest. Maybe you don't have to turn baby upside down to make baby cry. After, if they do all those things, baby doesn't cry, then they have to do the deep suction when they put a tube into your baby's mouth to like suction, because sometimes, most times it's like some mucus or like some secretions in your baby's mouth that is not making the baby's mouth make baby cry. So they may like suck out the secretion. They may give baby some oxygen and so many measures just to make your baby cry. I mean, turning baby upside down. Imagine there's a secretion in the airway. If you turn it, does it make the secretion comes out?
It doesn't do anything.
It doesn't. It's just like some belief we have. So I don't, if you're having your baby in the hospital, I don't think you have to worry about what your mother-in-law says in that instant, because your mother-in-law is not going to be the one resuscitating your baby. It's going to be either your midwife or your doctor or the pediatrician. And if you are having a home birth, except if you're having a home birth, you don't have a midwife coming for the home birth. Even if you're having births in the church or something, I feel that now they have some traditional birth attendants, they have some midwives that are attending, they are going to be the one to resuscitate your baby. And now later, say you are now back at home and your baby is like gagging or has some secretion in their throat, you don't have to turn your baby upside down to get that out. Just like if you are choking now, do you turn yourself upside down to get it out? No, you don't do that. So you can always rub your baby's back and you can still have that bob syringe. I feel like that is even available in Nigeria, where you used to suction the mouth, get it all out, rub baby's back, do everything you can do to just make the baby cry. Some babies, once you rub their back vigorously or you rub their chest, they'll just cry. So you don't have to turn your baby upside down to make that happen.
Yeah, thank you very much. I believe we do not have any other question. So, okay, Olua Kemi says, hello everyone. My suggestion is for the mother to birth her baby herself and to decline her mother-in-law's help. Yeah, that may work depending on the person's unique situation. I believe it's been an amazing time this evening. We've all learned, we have relearned, and I believe that we are better for it. I want to thank you very much, Mr. Lagunju, for making out time this evening to be here. And thank you everyone for the contributions, very, very sound contributions that we have all brought forth.